Hello, good morning. We are here about society. My name is Serratos and I am with
Yanira Coronado,
Villanueva,
Elsy Alejandra.
In our podcast, we talk about the different types of discrimination, news, and some more things. But today, we're going to talk about a problem in society that is causing controversy and affecting a lot of people. The topic is discrimination at work. We discuss the topic and talk about the different views about it. Hope you enjoyed the topic. First of all, what is discrimination at work?
Well, discrimination at work means when you are treated unfairly at any workplace, and this is a serious problem because there are several laws that are against this.
People can discriminate you at work, and employers, colleagues, employment agencies, also in interviews, cannot treat you bad and at any time and any moment.
So the question here is, why are you being treated unfairly? It's only unlawful and discrimination if you're treated unfairly because of age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex, or sexual orientation.
So another question will be, how can you identify discrimination? Well, you can identify discrimination when you're either treated unfairly or like when someone is getting aggressive and attacking you without no reason.
Employers mustn't discriminate against you at work. For example, when they determine your employment that you don't want and they assign you in that specific work.
Employers also must not discriminate against you when you apply for a job. For example, in the way they recruit you or by not offering you the job.
It is very important to know how to identify discrimination by knowing who's treating you unfairly, knowing why you're being treated unfairly, also what's the unfair treatment, and knowing how is the treatment unfair.
One day I listened to a case where a trainee approached to a doctor saying she felt discriminated in a racist manner by her patient.
I listened that too. That was awful.
Hey guys, do you think it is acceptable to refuse to deal with a patient based on her behavior?
I definitely think that it is not acceptable to treat with patients like this kind because it is not acceptable to be discriminated because discrimination isn't good and there are no exceptions.
I don't know, it's very confusing because it's a state labor complaint that is a anti-discrimination law, and it's very confusing because the trainee needs to give a certain service to this kind of people, but it's not acceptable that people like this are discriminated. I don't think.
And of course, it's an institution, so just behaving bad with a patient just because he is being racist, it's not fair because you are supposed to be like professional and not to act like and low at the same level as that person.
Yes.
Also, did you investigate further first?
Yes, I think that I will observe about why the patient is behaving like he's behaving because maybe he has another problems and he is trying to revenge with the trainee and he's probably frustrated, so I will probably talk to him and ask him about why he's behaving like that.
Yes, I think that is a good idea to investigate more about this client. What is the problem with the trainee?
Of course, because sometimes maybe the trainee can be lying, but I think that this is not the case. But of course, we should investigate more about the event.
Also, guys, do you think this could be considered discrimination in the other direction, trainee to patient?
I think that it obviously will be considered discrimination because even though if the is the trainee the one who is doing discrimination, it doesn't matter because it doesn't matter that if you have an important position or something. Discrimination is just when you treat someone unfairly because of some characteristic.
But what about if the patient is treated by the trainee and it's not like what you said? Like, for example, you said that the patient is treating bad the trainee. But what if it's the case that the trainee is suffering? No, that the patient is suffering from discrimination from the trainee.
I think that in that case, the doctor should investigate more about this problem because the doctor can do any movement that is like bad for the client or the trainee, and the doctor doesn't know what is going on in this case.
Yeah, I get it.
Yeah.
Also, what support strategy guidance can you offer to the trainee on how to challenge any inappropriate behavior?
Well, first to talk with the doctor to solve this problem, and like telling all the discrimination or something like that.
Also, if I was a trainee, I would talk to the patient and said to him, sorry, I cannot attend you anymore, or please just try to change your attitude right now because I'm trying to do my job.
Yes, I think that you can suggest or talk with the patient about that your behavior is not being the best, or like Elsie said, to talk to the doctor that maybe that she's feeling discriminated.
Yeah, I think that she should talk to the doctor and also to the patient and try to make a solution of all the problem. So, well, what will be your decision regarding this case?
I have two options. First, to talk to the patient and see if we can change his or her opinion, but I don't think that's really possible because if you were born like that, I don't think you can just leave it like that and treat correctly now the trainee. And then I would just, if I was a trainee, I would just tell, I'm sorry, I can't attend you anymore. I'm trying to do my job, but if you're not gonna cooperate, I'm not gonna finish this well, and I want to finish my work well.
Yes, I think that I also will try to refuse to treat with the patient, but if I have no option, I guess I will talk to him and ask him to respect me at any cost.
I think that is a good idea, but can bring another problem by the clients telling someone that the trainee treated bad in a bad way, or maybe in a unrespectful way. So I think that she can talk to the doctor and not to the client.
And of course, we are all in the same channel that racist is bad.
Yes.
Yes.
Of course.
So we are getting closer to the finish of this program about society. So talking about the case, my conclusion will be that she should have the opportunity to choose whether to avoid the patient and not attend it, or again maybe try to resolve the conflict.
Well, also what I conclude is about this topic is to respect everyone no matter what, because discrimination is a big problem that occurs since many years ago, and you should not treat someone unfairly just because you don't agree or like the way he or she is.
I agree with that opinion. And if you're gonna deal with some racist comment, I think that you should not either even talk or see the person that it's been treating you like that.
Well, I think that all your conclusions are good, and I think that we all get to the same agreement that the trainee should talk both with the doctor and with the patient to get into a comfortable or good agreement about this case.
You can find all the information in the next websites like Victorian Equal Opportunity and Human Rights Commission, also Citizens Advice. Well, thank you for listening and giving us your time and attention. We hope you enjoy and learn about this type of social problem and hope you had a good day, and we keep in touch with the next podcast here about society.
See you soon!